Now, the Ghana Health Service has also responded to a number of issues raised by Occupy Ghana. In a statement yesterday, we spoke to Kweku Sedbefia, who threw more light on the issues that they think that the Ghana Health Service must respond to. They have done so, and my colleague Gifty and Pia has been going through the statement released by the Ghana Health Service. Gifty, let's start with the issue of the case count and what the Ghana Health Service has to say in response to the claim of figures being massaged.
Kojo, so essentially, let me just tell you how they describe the concerns raised by Occupy Ghana. They describe it as, unfortunately, they describe it as something that seeks to impugn the professional integrity of health workers who are managing the pandemic. They say that they would have wished that Occupy Ghana rather genuinely sought explanations to get better understanding of what is being done by the health sector. So in terms of case count, they talk about cumulative count and the fact that it cannot decline. They say that what should be of concern are the daily reported new cases. They go on to indicate that the isolated spikes in local, or what's happening is just isolated spikes in localized institutions and localities and does not represent generalized diffused community spread. And then they go on to say that it is worth noting that in the last 1 week, 3 regions and 176 districts out of the 260 districts have not reported any new cases. So
let's touch on the issue of bed and space. Occupy Ghana did raise an issue that the facilities are being overstretched. What is the Ghana Health Service's response to that?
Well, in terms of bed and space, they say that we have never, and I'm quoting from the document itself, they say we have never exceeded our bed capacity as a country. We started this process with 450 bed capacity, which has increased to 700. It goes on to say that at the moment, we have 71 treatment centers across the country, and 21 of them are idle. That's what the Ghana Health Service is saying. And then they continue to say that they're working with the regions to increase the bed capacity for moderate to severe critical cases. They give an example, and they say that the 12-bed COVID-19 ICU wing that is coming up at the Greater Accra Regional Hospital is part of the efforts they are making to expand our ability to host people who need to be at the treatment centers. And they say that the largest isolation center that is used for those who are largely asymptomatic is the Pentecost Convention Center. As of 16th June, which is yesterday, they say that they had 356 inpatients, and the center has never operated at maximum capacity.
And that is very interesting, considering the news that is coming in from the Ashanti region today about the facilities being full and the health directorate in the region asking people to help them in terms of isolation centers and space to be able to admit people for treatment and also isolation. Gifty, thank you very much for bringing us portions of that statement by the Ghana Health Service. Now,